Department of Basic Education told Parliament's Portfolio Committee on Tuesday that at least 23,000 young girls between the ages of 10 and 19 are pregnant in Gauteng. There's also some 934 unattended cases of statutory rape and 1,300 new HIV infections detected in young girls weekly. According to South Africa's latest National Strategic Plan on HIV, STIs and TB, the highest number of new infections are being detected in girls and women between the ages of 15 and 24. The Basic Education Department says condoms in schools will be provided in vending machines. To discuss this and other interventions, we're joined now by the Chairperson of the Commission for Gender Equality, Tamara Mathebula. A very good morning to you. Thank you so much for your time. Some really shocking revelations this, as the story builds up and we get to understand even more about what is happening to young girls in South Africa. We're now learning that besides the pregnancies, there's also another big problem where 1,300 girls, adolescents, are being infected with HIV on a weekly basis. This is really shocking.
Good morning to you and good morning to your viewers out there. Yes, I must say that, yes, we have received shocking statistics of teenage pregnancy. And this statistics basically is looking at the period April 2020 and March 2021, where it actually points to the fact that more than 4,000, adolescent girls have been impregnated. And we're talking about girls between the ages of 10 to 19 years compared to other previous years, where I think between the period 2017 April and 2018 March, the figures were actually sitting at more than 2,000. And basically this shows that the numbers over the past 3 years have actually doubled. And this is a society and a health problem when you look at teenage pregnancy and statutory rapes that are happening around us. And I must say that if you look closely at what is currently happening, this is associated with quite a numerous issues. And if you look at causal effects, you will find that poverty is one of them, lack of education and poor access to sexual and reproductive health services, such as family planning, condoms, access to condoms both by, females and males and young boys in particular. This is problematic. But also we are also looking at recent phenomenon that actually occurs and relationships that occur between very young girls, teenagers, and older people, including educators at schools. So this is likely to happen because, we have young girls that have no idea of what is happening to their bodies. We have young girls that have no access to services that they are supposed to have access to. And we have young girls that are actually vulnerable to all kinds of gender-based violence, be it in the community or at schools, where the schools are supposed to be safe nets for young girls to actually, learn, but not actually be, girls that are looked into in terms of gender-based violence and sexual harassment and all of that.
With these alarming numbers that need urgent attention, we also know that, you speak about the numbers over the past 3 years, the doubling of those numbers in terms of pregnancies and HIV infection. But what we also do know is that the COVID-19 pandemic has also exacerbated the situation, because we've learned of the number of school dropouts, which I would imagine would also have had an impact in these figures that we're seeing. Where are we looking to in terms of solutions? You speak about the problems, you speak about the challenges that face a young girl in South Africa, but in terms of proper intervention and proper solutions, what is our roadmap?
Absolutely, I agree with you that the COVID-19 pandemic has actually exacerbated the situation, because you will find that generally, the young girls that were not attending schools or not going to school, during the lockdown, during the very hard lockdown periods, these girls were actually susceptible to all kinds of violence, sexual harassment, be it, at home, be it out in communities. This was actually happening during the lockdown period. They were actually praised during this time. And in terms of solution, what we are looking at and what we are in discussion with as the Commission for Gender Equality, you will remember that we did host a webinar. We were quite concerned. And on the 31st of August, as part of the Women's Month, we hosted a webinar. And this webinar basically was looking at sexual and reproductive health. But I think the focus of that webinar was to look at solutions in as far as teenage pregnancy is concerned, or learner pregnancy, if I can put it that way. We are in conversation, and in this webinar, we invited the Department of Basic Education and Department of Health, and we had the Deputy Minister of Social Development. And what we came out of this webinar and as part of solutions is that I think what we need to actually do is to, one, begin to intensify what we call comprehensive sexuality education. And comprehensive sexuality education should be part and parcel of the curriculum, whether it's something that needs to be looked at when we talk about life orientation, and it should also be part of the bigger orientation, generally orientation of pupils when they enter, the schools, particularly in high schools. And I must say that, last week, our minister, Honorable Angie Motshekga, did indicate that this is something that is definitely going to happen, that we need to empower our youth, and this life orientation, a comprehensive sexuality education, will be part of a general life orientation. But the second part is that as parents, we need to actually play our role of educating our young people about their bodies, about their body changes, but also about sex and what sex means. And I know that for a long time, this has been something that parents would shy away from talking about. It has been a taboo. If you look at our culture, if you look at our religion, it's a taboo. But I think we have a crisis situation here. It's an emergency situation. We cannot sit back as parents and think that someone is going to do the job on our behalf. So we need to actually talk about our sexuality education and talk to our children about this. But also, I'm also calling on government and associations that are responsible for teachers to say that teachers that are found to be guilty of having sex with young people, SACE must actually take a very serious stance against the teachers that are found to be having sex with young people or learners at schools. Last but not least, we do have our law enforcement, and we do have our criminal justice system that should actually look at the issues of, rape, statutory rape. But also we are calling on the laws and legislations that we are currently having in South Africa, such as the Criminal Law, Sexual and Related Matters Amendment Act of 2007. And we're saying that these laws must seriously look at issues of age consent. Because honestly, having sex with a minor or having sex with somebody who is ages 18 and lower is basically statutory rape, and the law and the enforcement should actually take its course and bring the perpetrators to book.
Absolutely. As you speak about teachers and you send out that very strong word of caution to teachers and their relationship with pupils who trust them with their safety and well-being, we're also learning of the Department of Basic Education now introducing condoms in the form of a vending machine. We know that the topic of condoms in schools and accessible to young people was one that sparked a lot of controversy in the past. How do you see this now working in terms of the introduction through a vending machine process?
Yes, the issue of condoms, condoms in school in the previous few years was very contentious. because it was introduced to say that at least we should have condoms distributed within the school environment. And there were quite a lot of contentions around this. And I know that a lot of people, including parents, were quite uncomfortable, about condoms. Parents and educators were uncomfortable about the issue. But I think the strong message that has been sent by the minister and the bodies, including the school governing bodies, is to say that let's actually have condom dispensers in the bathrooms or in the toilets in schools, so that young people, both young girls and young boys, can actually access condoms. They can prevent themselves, and if they really think that they are ready to have sex at that time, at least they should be prevented from having unwarranted pregnancies, and they should actually have been protected from getting infections such as sexually transmitted infections and HIV. And we know that these can actually cause long-term effects on young people as they grow up. But I think first and foremost, is to make sure that information is accessed around sexuality education by both girls and by both young boys, because they should know the right time to have sex, so that we really avoid these early sexual debuts because of pressures from the peers, pressures from the communities, and all of that. So they should know that early sexual debut can actually be prevented, and other things can actually be done just to make sure that we occupy young people with other activities rather than having sex among themselves. Thank you.
You speak about the cultural and religious taboos when it comes to the discomfort of children, of parents talking to their children about sex, about diseases, and a relationship with their body. You raise that, and you say that parents must do more to engage with their children. But the language is important as to how, as a parent, one learns to talk to their children about sex, and, of course, looking at the timing, which is the correct age to speak about this, when we're learning that children as young as 10 years are falling pregnant.
Yes, I did indicate that according to our culture and according to our norms, it has always been a taboo to talk to young people about sex. But if you go back to other cultures, I would mention just a culture that I know in KwaZulu-Natal, for an example. You will find that culturally there would be conversations that would be done by the older women in the form of the grannies, the aunties. They will be responsible for talking to young girls about their own bodies, about how they should date, about how they should behave themselves should they actually feel that they want to have sex. And if I can just mention that, young, older girls as well will be given that responsibility in the form of amakrikis and amachichi who would be talking to each other. And likewise, the younger boys were told and were taught by older men and older young men to say that when you are dating, this is how you should behave. When you are having sex, you cannot penetrate, and all of those things. So it's not completely something that was not there in our culture. It was there. And I know that culture evolves, but there are certain things that we can still go back to our cultures and revisit, because those things were working. Let's talk to our young people. Those aunties and those grannies are no longer there. We are now nuclear families, and the responsibility falls squarely on our shoulders as parents to actually talk to our young boys and talk to our young girls at an early age. And at an early age, we should speak to our young girls as early as
I'm going
6,
to
7.
have to interrupt you there. My apologies. Unfortunately, the time is up. Speaking there to the chairperson of the Commission of Gender for Gender Equality, Tamara Mathebula, speaking there about some of the solutions when it comes to these alarming numbers that we're seeing, girls as young as 10 falling pregnant.